recording on. And we'll do a quick icebreaker, just popping to various people. We'll just do a typical cheesy one. I don't have anything super creative today, but like what we're thankful for because we are in that season. So your name, and if you just want to say if you're a commissioner or a guest, and if you're a guest, who you're with, and then something that you're thankful for at this time. And I'm letting one more person in, so I'm not sure who this is. So I'll start. Ellen Bell, and the staff person and policy analyst for the commission. And I am just extremely thankful for just so many blessings in my life, including family, work, health, those things. And I feel like especially during these challenging times, it's really great to remind yourself of all that is present, all that is over what might be lacking in our lives. And so that's been my focus here lately, and I'm very, and I will pass it off to Alicia.
Hello, good morning. Trying to write everybody's names down. Am I introducing myself?
Man.
I'm Alicia Richard. I am one of the commissioners. I'm secretary. I take notes, and I'm grateful for my recovery always, every day, because I wouldn't be where I'm at without it. So I just continue to be grateful for that and for my kids to get to raise them. I'm gonna call on Matt.
I'm Matt Kroll. I'm one of the commissioners. I'm thankful for my family. They're always there for me. A good support system. Um, we'll go with Jesse.
Thank you, Matt. My name is Jesse Powell, Commissioner. I am most thankful for who my kids are growing in to be young adults, and how they show up and who they are and their love and compassion for one another. And I will pass it to Casey.
Hi, everybody. I'm pretty sick today, so I'm gonna stay off camera. But Casey Dreher, Commissioner. I'm here in Cottage Grove, and I'm thankful. Like many of you, I'm a family man, so I'm really thankful for my daughter. Every single day, I come home and see her. She says something so smart and funny, and just always making me laugh. So, nothing else can be that great in life. So, I'll call on Judge Jaco.
Let's see. I'm Megan Chico, and I'm a commissioner. I also have a big family. I'm thankful for them this week. I'm going to get to see four of them over Thanksgiving, and my one son is not going to be here at Thanksgiving, but he'll be back for Christmas. So it's nice to see everybody. I'm really busy right now, so I guess, thankful to have a job that continues to have a need for me to do my work. And thankful for all of you. I will pass it on to Dean.
Hi, everyone. Dean, one of the commissioners. I also serve on the Portland Children's Levy, Community Advisory Council, and several other things. Self-advocate as a former foster youth and stuff like that. And one thing I'm grateful for is, I'll actually say that I'm grateful for this commission because this commission does important work, and we need to keep improving upwards mobility and equity for foster youth, and to make sure that they're all getting support that they need and that they have good lives, which is basic. And so, yeah, I'm grateful for the work that this commission does, full of powerful, talented people who have a great passion for actually helping people, and for making sure that nobody is left behind. So, yes, thank you. And I'll call on Alexis, I don't think you've gone yet, right?
Thank you very much. I appreciate it. My name is Alexis Amarelli. I use she, her pronouns. I am Oregon's foster care ombudsman with the Governor's Advocacy Office. I am not a member of the commission, so I'm not a voting member here in this space, but I'm very grateful to be here. And something that I am thankful for. So the first thing that came to mind, I am a person with lived experience in and out of the foster care system as a youth. And something I will never take for granted, and I really stopped and felt so grateful for yesterday, was I did a grocery pickup and my fridge has food in it and there's food in my pantry. And I have like a plan for dinner for my kids, and I'm just really grateful for that. Ashley, have you gone already? I'll pass it to Ashley.
Thanks, Alexis. Hi, everyone. My name is Ashley Wortman. I use she, her pronouns. I work for the department out of the Office of Equity and Multicultural Services. I'm the Child Welfare Service Equity Manager, and I try to join you all as a guest from ODHS. Oh gosh. For gratefulness, I think, right now there's a lot to be grateful for. And one of the things that I instantly thought of is how many folks from the community are really stepping up and advocating for those who are being oppressed right now, and for those who are really experiencing some really hard things. And so I think, my daughter and I took some food to some neighbors a couple of days ago, and just the way that folks continue to show up for each other and make sure that folks are taken care of is really powerful to me. So I will turn it over to, I don't think that, oh gosh, Alex, did you go?
I have not gone. Thanks. I'm Alex Island. I'm on this commission. I use she, her pronouns. I am thankful for my friends who have become my family and all of the ways that we all show up for each other, especially over the past few years, which has felt really difficult for a lot of us. And so Kim?
Thank you. Hi, all. My name is Kim Keller. I use she, her pronouns. I'm the Child Permanency Manager for Child Welfare out of our central office. And I was sitting here thinking I have so many things I could say that I am grateful for, which feels like a real privilege for sure. Probably at the top of my list is my just turned 2-year-old granddaughter, who is undoubtedly the sweetest, most perfect little human on the planet. And when she says, "I love you so much, Mimi," it just melts my heart. So there's nothing better than that. Anyway, I am happy to be here, grateful for all of you, and I will pass it to Donna.
Thanks, Kim. Hi, everyone. I'm Donna Haney. I use she, her pronouns. I'm the assistant manager in the foster care program. I'm the guest, not a member of the commission. And I, like Kim, and probably many of you could come up with a lot of things to be thankful for and sit in that privilege. I'll go with the fact that my 2 boys who go to school out of state will be home in I believe it's 4 weeks. I keep counting, for about a month each. So I'm grateful that I'll get to hang out with them for the time being. And I will pass it to, I think Vicki is maybe the last step.
Thank you, Donna. I'm Vicki. I work with Salem Angels, a local nonprofit serving Marion and Polk County foster youth. And I am a guest and just thankful to be here and able to keep pulse on what's going on with our foster care community. Thanks for having me.
Hey, thank you, everybody. So normally at this point, we'd move to approve our last meeting minutes, but we don't have those yet. So we're going to wait till next month to do those. At this point, we have updates from Child Welfare Executive Leadership. Although my understanding is both Lacey and Rolanda are at an event. And so hopefully Donna could step in and Kim could step in with a little bit of an update for us.
I can try. I can do an update from our program.
That'd be great.
ELT is actually at the legislative they're in session, and so they're testifying. That's why they're unable to be here. I just we just had a public hearing on the rules that we have talked about in this commission this morning. So if anybody has any public comments, I want to thank everyone. There was folks here that attended our RAC, and I really, really appreciate that and the feedback that was provided. So we're moving forward with those certification rules, relative certification rules, and Foster Child Bill of Rights. And I'm sorry to say foster child, but that is the statutory title of that. Let's see, what else from certification? One of the changes that we haven't talked about here that is a pretty solid change for our certification staff is that we are moving from 180-day required home visits to 90-day required home visits. In August, we made the switch to require 90-day home visits for relative certified homes. And January, that will move to all certified families, so app, child specific, or relative. The requirement, if they're certified, regardless of if there's a child currently placed in their home, certification will be required to be in the home every 90 days. See if there's any other major changes. Sorry, not to call out Casey, but he did kind of put me on the spot. So I'm just thinking if there's anything else happening. And Kim, jump in anytime if there's anything from your end. No pressure. Yeah, I don't have anything else I can think of, Ellen, unless you can think of something that we've discussed or brewing.
No, I think you've got it. I mean, obviously, we're moving into, we've got the short session coming up.
Mm-hmm.
We'll be curious to see how that all plays out. And, but I think probably we'll have Michelle coming in after the first of the year to discuss that.
I can give just a brief update with my program area. As the child permanency manager, I oversee adoptions, guardianship, post-adoption, post-guardianship services, what we call post-permanency, all the words, and then the youth transitions program. And right now, and for the last year and moving forward for the next approximate year, we have been getting technical assistance from the National Center for Post-Adoption, and they are working with us to help us bolster our services and supports for families post-permanency. So that means a family that has adopted or a family that has finalized a guardianship. We've realized that while we have ORPARC, the Oregon Post-Adoption Resource Center, they are a fabulous, fabulous program. They don't, our state actually doesn't have the supports and services in place to sometimes prevent families from coming back to us and saying, they need more help. They're not getting what they need from within the community. And so the Post-Adoption Center has been working with us to see if there are some ways that we can enhance supports within the community, given that we are not the behavioral health program, but enhance some of the services and supports that are out there so that families can feel more supported in accessing what they need. And I would be happy if you all are interested to come to another meeting, only because I wasn't prepared today. But it might be beneficial for you all to hear what contracts we have put in place thus far, just so you know, as members of the community, what is out there for families. We have implemented several new contracts, and we're working on expanding, hopefully, a program that is currently in the Tri-County area called RSN. and it's basically a mental health response support, RSN response support network, that families can from the Tri-County area can call, and they'll get an immediate response and support within the home. So we are hoping to expand that statewide. There's some budget concerns right now, some constraints around that. So I don't know if we are going to be successful in expanding that statewide, but we are sure trying to. And the program, the national program, is helping us with that. So more to come for sure on the expansion of RSN. But like I said, if you are interested at a future meeting, I can talk about some of the contracts that we have been able to put in place. So just let me know.
Thank you both for being put on the spot and giving me a little update.
Sure.
Kim, I have a question, and if this is just, a district level thing, then that's fine. But I've noticed that, at least, by appearance in courts, it seems like DHS is moving quicker towards permanency for infants. And so not often waiting a year, but asking for 6-month permanency hearings on those. Is that like something that's been pushed forward as a policy in order to like speed up permanency, or is that just kind of an individual AG DHS decision?
I would say, Casey, that that's probably an individual case decision based on the circumstances in the case. That's not something that we are moving to make a policy change on. That said, we do have ASFA timelines, which, for those of you, the Adoption and Safe Family Act, that lay out specific timelines to achieve permanency. The first one is reunification within 12 months, achieve guardianship by 18 months, and then if the plan is adoption, achieve adoption within 12 months of the child coming into care. And so, we, as a whole, we are trying to do better at meeting those 3 timelines. We are super close on 12 months to reunification. Our average time to guardianship is way off. We're running in the 30 or so months to achieve guardianship. We're a little bit closer on our timeliness to achieving adoption, where the average is like 28 months right now, where the federal timeline is 24. So we are trying to implement some strategies around achieving permanency in a more timely fashion. We believe strongly that the relative pathway that Donna talked about will be one of those ways in which children get to permanency if they are not able to reunify with their parents, hoping that relative placements are identified early on and that we can, move to permanency quicker to meet those ASFA timelines. But no, there's no policy change on the horizon, Casey, around permanency hearing at 6 months. So that must be, like I said, an individual. I haven't been made aware of any specific cases where that's happening, so I don't know what the circumstances would be surrounding that.
Well, and oftentimes it's requested by the children's attorney as well, but
Okay.
it does seem like it's happening more frequently. So I was just curious about
Yeah.
it.
Yeah. I mean,
Um,
I'll keep my ear open for anything like that, and I can always reach out to DOJ and ask them if they've noticed a trend or an uptick in that as well, or if it's specific, counties where that's happening.
I was just curious. Thank you. Anybody else have any questions? And sorry, I know my nose or my voice sounds weird. My nose is all stuffed. Okay, if no questions, Ashley, it's a little quicker than 12:10 when we had you on the agenda, but are you ready to go now?
I am. I can definitely do that.
Thank you.
All right. Thank you so much. Let's see. I want to make sure I share. I have a few PowerPoints open, so make sure I get the right one up. And I believe that this was attached for you all because I did send it a little while ago. So let's see here. There we go. So as I mentioned, I am Ashley Wortman, I use she, her pronouns. It's always fun to have a large photo of yourself on a slide as you explain who you are, but wanted to provide some context of who I am and kind of a little bit about the program or the unit I'm with, and then I'll talk about why I'm here. So I work within the Office of Equity and Multicultural Services. It's also known as OEMS. I've been in this role for over 3 years now. Time flies when you're having fun. But my experience, just so that you all know, prior to this role, I actually started with the agency back in 2013. And I started as an administrative staff within child welfare, actually in Eastern Oregon in a pretty rural area. And then had my kiddo. I'm a single mom and she's 10 and a half. The half is very important in our household as we count down. But then when I came back, I was a caseworker for a few years. And then I moved to what we call the Central Office of Child Welfare as a critical incident review team coordinator or a CERT team, part of that child fatality prevention review program. And then after about 3.5 years, I moved into this role that I currently have. However, I also have over 4 years of experience leading Equity and Inclusion Committee as well as an employee resource group. And then I also have over 4 years where I led the implementation and now coordinate that mentoring program for employee resource group members. My experience in the private sector is in leadership and management. And then I also have different lived experiences and volunteer in my community. I actually live in the Salem area for the last several years now, but wanted to just give you a little bit of who I am and what I'm doing here for the agency. And so a little bit of information about OEMS. I believe I've come, oh gosh, a couple years ago probably and gave some information, but I know that you all have some new members. So I wanted to make sure to revisit this. And so I work out of the director's office, which supports the entire agency. And our units or our team's mission is to really help embed equity, diversity, inclusion, belonging into every aspect of the organization and really help move closer to that equity North Star. We have several pathways of work that come out of our unit, including language access, Real D and SOGI data equity, which is race, ethnicity, language, disability, sexual orientation, gender identity and expression. We also oversee the employee resource groups and the equity and inclusion committees within the agency. And then there's a team of service equity managers, as well as focus on community engagement and workforce development. There is something called a DIB plan, which is our agency's diversity, equity, inclusion, and belonging plan. That is supported through our unit, but it is for the entire agency. So I always like to plug that. In my role specifically, I am responsible for implementing something called the Unified Equity Framework within child welfare. This framework is for the entire agency. However, our service equity managers are supporting those core programs in their building of that framework. And what that is it's actually 4 mechanisms that are really designed to examine practice, policy, procedure, pretty much everything within that program area, and really focus on how do we address that disparity and increase positive outcomes for folks receiving services as well as the workforce. And so those 4 components are listed right there, which is a programmatic assessment, equity plan, equity dashboard, and a service equity council. I've come actually and talked to you a little bit about the service equity council in the past, which is up and running, which is exciting. But today I'm really going to be here for the programmatic assessment conversation. Excuse me, a dog just walked by, and so if you hear my dogs bark, I apologize. They get really upset when people visit. But I'm going to talk a little bit more about the programmatic assessment and kind of what that means. But you can also see there's a whole lot of other additional work streams that I'm more than happy to come back and chat with you all about. But I want to make sure I have enough time to dive into that assessment piece. And I didn't mention this earlier, but feel free at any point if you have questions to interrupt me. If I'm talking too fast, let me know as well. You will not offend me. This stuff, it lives in my head for a long time, so I'm happy to pause. So kind of turning to the core reason why I'm here is about the programmatic assessment. And these are comprehensive, culturally responsive analyses that are being done, really aimed at identifying what we call system improvement opportunities that will help address disparity and disproportionality. We have not ever, to my knowledge, conducted a internally ran programmatic assessment in this way or for this purpose. And so this is something that has been built from scratch, essentially, by the Service Equity Manager team. And so each ODHS core program, like self-sufficiency, child welfare, aging people with disabilities, and so on, is expected to undergo this process. And I have been working on this since January of 2024. So doing a lot of capacity building, strategic planning, all of those. Obviously, each of our core programs are unique from each other. And so that means that this process is going to look unique because of that. Child welfare is pretty much the only non-voluntary program that exists within our agency, give or take a couple of areas. And so that means that this is going to look quite different than some of the other areas as well. One of the things I also want to highlight is that I have built this along with some other folks, which I'll talk about in just a few minutes, that it has that foundation of safety science and safety culture. And what safety science, safety culture is really looking at how do we identify the barriers and gaps that exist within the system and so that we can better support the folks receiving services. However, also the workforce that's responsible for delivering those services. And really it looks at removing the finger pointing of who is responsible for that versus how do we equip the system to be better? What policies or what practice differences, what coaching, what professional development needs to be built into that? And so just a little insight into the structure and the phases, as there are multiple phases to this process. On the left-hand side, you can see it says pre-assessment. That's really where we've been this entire year and honestly since last year. And that's really where, again, there's been a lot of skill building and knowledge growth for the Service Equity Manager team so that we can successfully support the programs we work with. And also there was a strategic plan that was built and proposed to the executive leadership team in child welfare early in 2025. And then an advisory group was formed to support the co-creation of this assessment. And that advisory group includes folks with lived experience from community and tribal people who are not part of ODHS, as well as staff and leaders across Oregon who work for child welfare and have different positions and diverse backgrounds. And so this advisory group has been responsible for recommending the scope of the programmatic assessment, which I'll share about on the next slide, as well as helping to co-create the electronic survey tool. And so this is really the foundational structuring because this process is going to repeat itself every few years. It's built to be cyclical so that we can continue to run this programmatic assessment. So then phase one is an electronic survey tool. This is really our quantitative data collection. And I like to think about this as like it's the window of the house. I like to use house metaphors because I'm not good at gardening or keeping things alive if they're not human or pets. And so it's the window of the house. It's giving us a little bit of insight into like, some of that stuff looks interesting. I wonder what's happening in there. This is a very large participant group that will be invited to this, including the commission. And so then phase two is our qualitative data collection. This is really where we get a really much deeper understanding of what's going on in that house. We went in the front door, now we're getting really curious about, the living room perhaps, or something like that. So external and internal respondents to that survey tool will be invited to complete a debrief where we can ask some deeper questions and really start to pinpoint some of those system improvement areas. And then phase 3 is the analysis. And this is where we're going to use our primary data, which is from the tool and the debriefs, as well as secondary data. So like the Child Welfare Data Book, for example, or some of those Child and Family Services Review data, the things that already exist and have been published regarding Oregon child welfare, so that we can then bring that together and identify specific actions and strategies. There will be opportunities for different folks internally and externally to be a part of that strategic planning process. And there will be more information to come next year. And the Service Equity Council and Child Welfare will be a primary driver. They'll essentially flip into an advisory group type role for that process. Any questions on that? I've been talking for a little bit, so I want to make sure. It's probably overwhelming as well. Okay. So I mentioned earlier that the advisory group recommended the scope of the programmatic assessment. These 5 areas are what was determined to be the scope or the focus. And so you have culturally responsive service delivery or responsiveness to unique needs, interested parties' involvement in system change and co-design of decisions, staff motivation and engagement, cross-program and agency coordination, collaboration, and alignment, staff training, and support. And so once these 5 areas were identified, that advisory group began looking at what are some of the questions we can ask respondents or participants to better understand what's influencing these areas when we think about disparity in Oregon child welfare. So, you know, that's really what their focus has been for the majority of their role. And essentially, those questions are becoming the electronic survey tool. And so it gives us a really broad understanding from that very large participant group about their experiences regarding these 5 areas. And so the electronic survey tool is going to be a brief form that is really, again, built to gather quantitative information from a lot of people. Each tool or form will have a consent clause to ensure that the folks responding to it are agreeing that their answers will be included in this assessment process. There is no personal identifying information that's being asked, so like no name or email address, and there is optional demographic information. We want to be very respectful of the fact that right now there's a lot of fear around reporting aspects of identity, especially to a government system. And so that's why that demographic information is all voluntary and optional for folks. All of the questions in that tool will be directly connected to the focus areas we just saw in the previous slide. And folks through that form will have an opportunity to opt in for a qualitative debrief. It doesn't mean that they will do it. It just means they might be interested. And so that tool is really going to, again, ask a few questions about all 5 of those areas and give us a good broad understanding of someone's experience. And we will store that in an application called NVivo that the agency uses. And that's how we're going to be able to do that primary and secondary analysis of our data. And the information from that analysis and the data used will essentially draft an equity plan, which is another pillar of that framework I mentioned earlier. And all of those strategies, we're going to do our very best to create them in a way that they are specifically connected to current initiatives. We don't want to just keep creating more and more initiatives because it's really hard to get a lot of things done when you keep adding to the list. And so we really want to focus on how do we enhance current initiatives to reflect the findings from this programmatic assessment. And so that means we're going to use something called targeted universalism. And for anyone who's not familiar with that, it looks at who is farthest away from positive outcomes, and then what are the strategies needed or the actions needed to support that group, recognizing that the implementation of those strategies are also going to benefit every single person because they're not just implemented only for one group, they're implemented for everyone. But we're looking at who is farthest away and what specific actions might be needed to get them closer. And so then we'll be able to enhance current strategies to reflect that. I've actually been spending almost a year and a half now meeting with a lot of folks within child welfare who are leading some of the major initiatives and talking about this process so that when we get to the analysis phase, we've already done some of that invisible like webbing between, and it will be everyone's getting set up for success in order to implement and are prepared to receive some analysis findings. Any questions on that? Any thoughts?
Not a question, more of a thought.
Yeah.
I'd love to get like my hands on that like demographic, data to see the effect of neurodivergence, how many times people moved, etc. So because that would be very useful information, of course, for us to see as an advisory council about who we should be also keeping in mind that we maybe haven't been thinking about because we need to make sure that we are focused on the people who are reporting the most issues. Or at the very least, the people who are having the most issues, even if they aren't reporting it. But, demographic data should at least give us a good idea, even if certain things can be underreported.
Yeah, thank you for that. Yeah, we'll be using RealD and SOGI data standards, so race, ethnicity, language, disability, sexual orientation, and gender identity information in that. And hopefully we will have folks who feel comfortable sharing that. But again, it will be optional. But once we get to, this won't be the last time you hear from me, for one. And I'll talk about that and how y'all are going to be invited to participate, not only in the electronic survey tool, but also the strategic planning for sure. And I'll be coming back to share some of our findings. Thank you for that. Did you have something else? I saw you on mute, sorry.
Oh, I was just gonna say, great, thank you.
Yeah. Thank you for the comment. So why am I here? Why is this important to you? It's very technical work. However, your experiences, your wisdom, your expertise is really important to this. I, for one, am very much a advocate for co-creation. I don't want this to just be something I created. This has very much been, how can I create this with folks who not only experience the child welfare system and are impacted by it, but also those that work with and for the department, and so that we can create something that truly is intentional and sustainable. So you're going to receive an opportunity to participate in that electronic survey tool. If you do opt in for a qualitative debrief, you will probably get some information about what that means and next steps for me. And ultimately, any of the information that you share is going to help shape that equity plan for child welfare. So I hope that once you see that email come in from me, which I estimate will happen in mid to late January, we're right at the tail end of shoring up some of these pieces, that you will complete that electronic survey tool. And if you provide information to participate in a qualitative debrief, watch for information from me. I'm hoping end of February. Again, this has never occurred before. And so, things that I'm like, oh, this sounds like a really good idea, I find out maybe a little more intensive than I thought. So that's why I'm kind of giving estimated times. But you will hear updates from me along the way. This won't be the last time you hear about this process, the data that comes out of it, or even how to become involved in those strategic planning sessions that I will be hosting next spring and summer. Any questions? I know that seems very probably overwhelming. It's a lot of information. And I could talk for a lot longer, like hours on this, but I just wanted to kind of come and give some context to why you will receive an email from me in January. And I'm also always happy to reach or have a one-on-one and share some information if you're interested.
All right, any questions for Ashley? Okay, well, thank you, Ashley.
Yeah.
I think that, somebody's got a question.
So I did have a question, actually. So one thing, so having been in the foster care system myself, and knowing that like a lot of people are are becoming more diagnosed with neurodivergencies and stuff like that. And there's, lack of mental health providers in Oregon. And in fact, I was on the Oregon Commission on Autism until it was dissolved. And one thing we were focused on is how that big one, I think, in Central Oregon shut down. So I was going to ask if you are aware of anything in regards to the mental health care situation in the Child Welfare Department and how you guys are handling that so that that I could learn just a little bit more and see what I think, could need to be like tweaked or stuff like that to improve outcomes
Yeah,
for the youth.
thanks for that question. I would be able to speak more to like the accessibility pieces internally to support, accommodations and other pieces related to that. I think that question is probably more for like Kim or someone more in the work day to day than I am. So I'm going to defer to Kim. I see maybe you might have an answer.
Oh,
I
gotcha.
was going to say, can you repeat the question, please?
Huh? What did you say?
I said, can you repeat the question, please? I'm sorry.
Oh, gotcha. I thought you said next question, so I was confused. All right. I know. I was like, what? So basically, what I was thinking about, I assume she might be handling this due to, I don't know, mental health equity. You get what I mean? Access to mental health care. So I know that back when I was in the system, I went to Cascadia and stuff like that. I remember that. And I know that recently, there's been a lack of access. Well, not really lack of access. There's lack of supply of many mental health care professionals, especially in the Portland, Oregon area. And it's going to become more of a problem when there's growing needs for more specific neurodivergence specialists in that field, because I know that neurodivergence is and stuff like autism, ADHD is just keeps exploding and stuff like that. The diagnoses, that is, we don't know if it's actually exploding. That being said, though, so I was curious if there's any data about that, about like the access and what the options currently are and stuff like that on that side. And then the second question is also related to mental health, which is actually more in regards to how is the department thinking about full spectrum mental health, because you have to remember social relationships perform a regulatory role on people's mental and emotional health, and sometimes I feel like we've over prioritized the medical side of it and not enough of the social side of it, and I expect the government to be sort of on that.
Yeah, I think so. My answer, unfortunately, to both of your questions is I believe that's an OHA CCO. That's the agency, OHA, and then the CCOs. They are responsible for the mental health provision in our state. And so I think you should invite someone from OHA to come to this meeting.
Sure, I'd definitely be up for that. So I guess looking for that in the future.
And I do want to highlight that there will be a focus on accessibility within the programmatic assessment. So you will see that in the electronic survey tool as well.
Thank you.
Yeah.
Yeah, Ashley, this is Jesse Powell. I got a question. When you were talking about your information, you used an approach, a term that I didn't quite grasp the whole wording of it. It was universal something another.
Targeted universalism. Yeah.
What was that again?
Targeted universalism.
Okay, thank you.
Yeah. Do you want me to explain that again, or?
Yeah, I would love to. And I'm on my phone in the car. Could you type that into the chat as well? That way I can copy and search it up and do some research myself, because I do a lot of housing supportive models and projects and just stuff like that. And I really like that approach. And so, I'd love to hear a little bit more about it as well.
I will also drop a link to a organization that does a lot of work around that, which is the Othering and Belonging Institute. But targeted universalism essentially it's very technical, but the way I like to explain it and understand it is that you look at who is farthest away from positive outcomes, and then you really break down and co-create strategies with them on what they need to get closer to positive outcomes. And then, but you recognize that you're implementing those strategies for everyone involved. So, for example, if we're looking at the Oregon foster care system, you can look and see that there's overrepresentation of Black and African American children in Oregon. And so, really looking at what would that community need to get closer to positive outcomes, knowing that those strategies are going to be implemented across the board so that every child in foster care would receive those approaches. And that could be, for example, professional development around culturally responsive engagement for caseworkers, right? And so it's looking at who is farthest away and how do we get them closer, knowing that everyone's going to benefit from those strategies.
Yeah, cool. Thank you.
Yeah.
Got a quick question for you, Ashley. Could you explain a bit more on your scope of who the electronic survey is going to be reaching? Is it going to be reaching resource parents, bio parents? How far is your scope looking?
Yeah, thank you for that. I did not mention that. I appreciate you calling me in on that. So every single child welfare staff and leader will receive an invite for that, as well as I think there's about 12 committees or councils that are going to receive that invitation. So you all, as the commission will, the Parent Advisory Council, the Resource Parent Council, the Youth Advisory Board, I think is the name that it was recently created. So I'm trying to keep them all straight in my head. We also have the Service Equity Council, the ICWA Advisory Council, so the Indian Child Welfare Act, the Social Service Directors at the 9 federally recognized tribes of Oregon, the Child Welfare Advisory Council, the Fathers Advisory Board, and there's a couple more in there. Yep, I got CWAC. There's a couple more in there that I don't remember off the top of my head, but I can definitely get you a full list if that would be helpful. So essentially almost 4,000 people will be invited to complete that tool.
Okay, any other questions for Ashley? Okay, thank you so much for being here, Ashley, and for that presentation. I'm really looking forward to the results from it.
Thank you. I'll drop my contact information in there, and then I have to hop to another meeting, but I appreciate the time with you all. It was great to see you.
Thank you. Okay, so we're a little bit ahead, 10 minutes ahead, but we're to the part of the agenda that's follow-ups from the October planning meeting. I'd invite any commissioners here to jump in if you have further follow-ups. I don't have a lot of follow-ups. We heard from the governor's office on what their priorities are going to be, and then we had an opportunity to discuss all of our priorities. We also heard from another commission on kind of how they operate. One of the things that we did discuss at the end of the meeting, which was a little more tense, is the selection process for the commission. We did talk with the governor's office a little bit more about it. We asked Rachel to come, and chat about it at the next meeting. She wasn't able to be here today, so hopefully we'll get that on the December agenda. One thing that I just want to throw out there that I thought was interesting was, that the other commission talked about reports that they do. And I don't know if we do a lot of reports in this commission, but when we look at what our statutory requirements are, it might make sense for us to do a semi-annual or an annual report regarding kind of, the statutory things that we're supposed to be looking at. So that we can keep track kind of year after year of, where we're at in permanency, where we're at in adoption. Some of the numbers that Kim was actually going over earlier, and she probably has handy. The other thing that kind of stood out to me is the size of their commission and the number of advisory commissions they have, or committees. When I look at it, we have an education subgroup, and then I think that the board just or the commission just kind of steps in when we need to on other things. But I think it's worth having a discussion of, the size of our commission and our subcommittees and what would work best for, actually getting that data and analyzing it and providing a report to the governor's office on it. So that's just kind of some of my thoughts from the Planning Commission. Does anybody else have any thoughts on follow-ups that we need to be doing or any other thoughts on that?
Yeah, Casey, I'll just jump in.
And Ellen, you're really quiet. I'm not sure
Yeah.
why, but the whole meeting you've been really quiet.
Anyway, let me see if I can change that.
Is that just my computer or is anybody else having trouble hearing Ellen?
Is
No,
this
yeah, that's better, Ellen.
okay?
Okay.
Yeah, well, after these updates, I have to switch around on microphones and things for some reason. Anyway, just for people that are newer, we do those statutory reports. We're very up to date on those. They are posted on our webpage. And if you want to ever see any from prior years, it's every other year. And I guess 26 will be the next report. There was one year that was missing. And so we did one, I think it was, we did one in 23 and we did one in 24. If Pamela was here, she would remember. But we had those 2 years, and now we'll have one in 26 that will be due, the biennium report. But and then of course we did our 2024 recommendations. So I mean we have several different things, but I do like that idea if there's additional things. But we are just so for people that are new or haven't been around very long, we are in compliance with the statute requirements. And probably some people, I mean, I know Judge Jaco probably and Alicia remember that as well, since you worked on that and given feedback.
Yeah, and I agree, Ellen, on the style of report you're talking about. I was talking about more of a, I guess quantitative assessment of when we look at like where are we at on permanency, where are we at in, timelines for reunification. I don't know if I can tell you with the materials we have, where we are in 2019 versus where we are today. And being able to kind of track those numbers, I think would be helpful. And then understanding, we get the general updates from ODHS, but how do those tie into each and every factor? Are there any things that we're not working on? I just think there's a lot of information there that we could get, and it's a lot for volunteer commissioners. And so in my mind,
Absolutely.
I'm like, man, if we had somebody to really analyze what's happening in permanency, and then a subcommittee to really analyze what's happening in or not self-sufficiency, but other parts of it, right?
And there are dashboards. We do have the dashboards on the ODHS website. And we used to kind of talk about those, but it's been a couple of years since we've really gone over that. So that might be something we want to revisit too, is looking at some of the data on the dashboards, and making sure everybody's acquainted with that. I don't know. Do you have anything else to add to that, Donna or Kim, in terms of
we have oops. I can't get we have a data book. So there's information every 2 years. It's statutorily required that we put together. But Judge Jaco, I think, has wanted to pop on. And
Yeah, the judicial department tracks all of those timelines and forever all of the how long it takes to get to the permanency hearing, how we're doing as far as that options go. And they publish those quarterly. They pay somebody full time to analyze that data from all the courts, and it's broken down by different jurisdictions and the coverage of the circuit courts. So those are available. I can get you guys a link to those websites.
I think that'd be fantastic in terms of, what we're looking at in terms of our reports. And that seems like really valuable information for us to analyze. Outside of what I was just speaking on, though, does anybody else have any follow-ups that they wanted to, make sure that we're following up on from the commission meetings?
Alicia
from the
has her
planning
hand
meeting?
up.
Thank you, Ellen. I was just looking at the notes that I took from that meeting, and something that stood out to me was that they reviewed their bylaws every 2 years, and then when they get a new chair, they review them. So I found that to be interesting. Maybe that's something we want to do. They also had a very larger group than we did. I mean, they have 21 members, right? We don't have that many, so it's sometimes more difficult with less people. What was the other thing? Oh, and then that they did a governor's proclamation once a year. Do we do that? No. It's kind of like when we set our goals for the year. I think we do sort of like find things we want to work on, but I'm just pointing it out so we know if it's something we want to bring in. And I can send these notes out. Would that be good? Should I send them to you, Ellen? From the planning, from the
I think I included them.
23rd?
I believe they were included on the invitation. But when I send out the minutes from, well, we have to send out the
September.
September minutes.
Yeah, I have
I
those.
can
Sorry about
also
that.
I can send that. One thing that I took some notes on that I wanted to ask if people were interested in was from that last meeting was just each person sort of had pet projects that they were interested in, and we could do document that kind of lists a few bullet points that of what each person stated. If you're interested, and just share it among, among commissioners. I mean, it doesn't necessarily have to be posted on the website as long as we're posting we posted the video already. So, thoughts on that? Would you like something like that? Would that be helpful?
That'd be fine with me.
Yeah, I'd appreciate it. I didn't know who you were asking, so.
Anyone for sure.
Cool.
So that could be attached. That could be attached as well with the minutes so that we could, revisit those priorities.
Yeah, I think that would be good. It would allow us to also, if we're just getting back in from something, it allows us to refresh our minds as well on what we care about. Because, some people have the attention span of a squirrel.
And
Yeah,
then Ellen,
Yeah.
whoever was just going to speak can go ahead and go real quick.
This is Jesse. So I just wanted to bring it to our attention. Like, I don't know who else had seen or how this can align with us. It's in our wheelhouse. So the President Trump and Alani, I think it was one of Alani's, the First Lady's initiatives around child welfare and outcomes with the education and after child welfare involvement. It's around the education piece. Maybe it'd be a better topic to talk about, but still it aligns with a lot of the work that we do. That was just signed in, I think it was Friday or last week sometime. So I think it's something that we may want to look at and kind of like just bring it present to mind, like that type of support and how we can align with that order that was put in place. I think it serves the purpose of our commission quite well, and since it's new, I would like to be able to try to get ahead of that, or not get ahead of that, be able to just have that in our wheelhouse, and have that support as well. So maybe we can talk about that in the education group. I think it's tomorrow or something. But anyways, did anybody catch the signing of that?
Just FYI, tomorrow's education group is canceled and rescheduled. So you'll see that. Catherine sent a rescheduling message a little earlier this morning. So just check for that.
Okay, did anybody catch the signing of that that thing that Milani signed around child welfare?
I saw something. I'm gonna look it up because my memory's terrible.
Yeah, I just caught a couple like real small snips, but it's the work that we're doing and its outcomes and its child welfare and its supports and education and being able to track the information beyond just reunification, right? A lot of it has to do with adoption, permanent guardianship, and then tracking them outcomes afterwards as well. So I know that we talked about like that's a gap in our data, and what struck me curious is that like she's trying to create supports around having that data and having that long-term support. So I thought it was amazing, and it fits right into the type of work that we're trying to support and further.
Yeah, I think it's about young people aging out of foster care.
Yeah.
It's more about like their future, making opportunities. That's a little bit of what it says.
Yeah. Okay, I was just wondering who else caught it.
Ellen, would you mind noting a subject for the next agenda item to have a quick discussion around the bylaw committee?
The what now?
Like a bylaw subcommittee or committee?
Sure. And just so everybody also is aware, we did redo the bylaws. What year was that? 20, was that
There's
23?
two.
The end of 23 or 22? Yeah. So that was our last year. So good to know. And if anybody, then you can also find those on the web page. But if you have any questions, please let me know, and I'll make sure to guide you to them.
Perfect.
So we'll put that on the next agenda.
Did you say 2022, Ellen?
I think it was 22 or 23.
Okay, I can't remember. I was probably on this commission then, though. So
Oh yeah, you were. It went through. It had to go. In fact, I know it wasn't approved until 23 because
Okay.
there was many. Remember, we had to wait X number of months and send it out several times. There was there was a time frame we had to that I had to be aware of for you all to make sure people had weighed in. So I think
Okay.
it might have been 23, but we can find all of that. I'll find all that information, and if I know Pamela has some of that as well.
Thank you, Ellen.
Yeah.
The last little update I have regarding our membership is we're still at 9 people. We could have 13. My understanding is no names have been put forward to the confirmation to the Senate at this time. So I don't know when we're going to fill those seats. Certainly, that's like the bare minimum support we can get to make sure we have quorum. At 13 people, we can have 6 absences and still have quorum. But with 9, we can only have 2 absences and still have quorum. So, our quorum is on the number of commissioners that could be seated, not the number of commissioners that are seated. And so thankfully, I appreciate everybody's effort to show up every month because it gives us the quorum we need to move forward. But hopefully soon we can have the rest of the commission filled out. And I think that gives us some more support on the subcommittees as well. Okay, if nobody else has follow-ups from October, it's not on the agenda, but we'll go ahead and open it for public comment. And if there's no public comment, we'll close that and we'll open it for member comments, concerns, or topics to address. So this is just an open spot if any commissioners want to bring something to the floor.
Yes, I actually would. And this is sort of related to a little bit earlier, which is something I thought of though after the the conversation had passed. So I think either on this commission or on the Oregon Commission on Autism, I can't remember which. We found we found the data that like 20 or 50 out of 1,000 foster youth or something like that reported experiencing some form of abuse and stuff like some form of abuse, I believe. And so that's been something that's been on my radar that I've been wanting to see if we can get more information from the foster care system about how they if they've received that data, how they're sort of handling that, what steps they're planning taking on the future and stuff like that to prevent that in the future, because these are formative years, and everyone deserves the best life they can get. So they deserve a safe home. So I think it's sort of self-explanatory of why I think we need to really look at that, and depending on the size of the problem, make it scale how we should prioritize it.
So, Dean, you're asking for a presentation from somebody within DHS on kind of the numbers or the process of how people go reporting the numbers of those, and then how DHS responds to them.
Yeah, exactly. As well as the process of how they also determine, the process of prevention, because there should obviously be preventative measures through the screening system as well. So that's also something I wanted to look at, since I'm not sure because I'm not really sure about that. I just don't know. I mean, I don't know the processes and all that.
Donna, is that, as far as screening, are you talking about like foster parents? I would imagine that go through certification?
Yes. I'm not too familiar with that side of things.
Yeah, we could.
Sorry, Donna.
Oh, sorry, Dan. We could provide the data around maltreatment and care, and talk about some processes that are happening to obviously prevent. We can talk about that process, but then also notification processes are really important, and something we're working on now, so that everybody who should know when there's an allegation regarding a child in care is notified. So yeah, just whenever that fits on your agenda, just Ellen can give me a little heads up and we can pull together some information. It's a great topic.
I'd also be interested in knowing what training program you're using for foster parents, and whether it's the same for relatives and non-related people.
Yeah, we can talk about all of that. That's great. I mean, I could answer that right now, but I don't want to mess up your agenda.
Is it still Foundation?
It isn't. It's a curriculum that we call RAFT, but it's a national curriculum that we adopted for Oregon. And we could actually have someone come and talk about RAFT. Then the short answer for your relative question is that it isn't. Relatives can go through RAFT, but it isn't required. So it is a bit of a different process for training for our relatives, relative caregivers. But yeah, we could have someone also talk about RAFT, just high overview the topics, and it's very it's a lot more Judge evidence. What's the one that's right below evidence-based, but research-based? Yeah, than foundations. What's that? Sorry, Kim.
Promising.
Yeah, exactly. It's a lot of it's much more in-depth training than foundations was.
Good.
I think we made that one of our goals one time. I remember us talking about this. So I did write it in the notes that maybe we can circle back to have someone come and talk about RAFT.
Yeah, that would be great. We're going to have at the beginning of the year, Mary Gielen's coming to talk about the new 4E plan once it is approved, and that will be great. And then also, there was something. Oh, I know. I was thinking about having Sarah Fox, if you'd like, to come and talk about some of the mental health, some of the things going on, because that also they sort of tie together. So if that's something folks are wanting, we can we can just decide what order we want to delve into this.
Yeah.
I also have been thinking that it would be interesting to talk to Ashley some more about targeted universalism and whether that's a strategy to try and keep from losing as much federal funding as we have, even though we continue to think that the diversity, equity, inclusion are important in this state.
Another thing, if we're talking about putting things in the docket, potentially, I would like to also explore the opportunities like apprenticeships and stuff like that, and other things beyond just typical recommendation for college that are currently going on in the foster care system, and what opportunities there are. So, since that's as I've repeated at length these meetings, one of my big focuses.
Okay. Anything else from any other commissioners? All right. Then we're gonna go ahead and call the meeting a little early. We'll go ahead and adjourn the meeting at 12:43. Thank you, everybody.
Thank you.
Thanks, Casey.
Good meeting,
Ellen,
everyone.
I'll send the
Thank
meeting
you.
minutes now, so I don't forget this time.